My guest is a mental health consultant. He holds a master's degree of philosophy in mental health with honors. He studied at the City University in London, has a certificate in education, teaching, and assessing in clinical practice. He is also an author. He migrated from Trinidad in 1990, returned to Trinidad in 2012. That's after 25 years gaining international experience, during which he contributed significantly to the cutting-edge psychiatry in the United Kingdom and Europe. He subsequently established 2 registered foundations here in Trinidad. One is NICER Foundation, which we'll talk about. That's an NGO, primarily established to assist in promoting positive mental health in Trinidad and Tobago, and Conflict Response Institute, that is the other one. They are providing training in interpersonal conflict management. Let me then welcome my guest, Carl Ryan. Carl, thank you so much for coming in this morning. Great to see you.
And thank you for the invitation.
It is something that we're very happy that you're here to discuss, because I feel many times folks walk away. If we can walk away and look away, it makes life very easy. It's convenient to walk away and look away, and that is something we're hoping that after our discussion, folks will have a more sympathetic look. Sympathetic. I didn't say. Okay. Back in 2013, Carl, when you returned to Trinidad and Tobago, speaking at the Human Resource Management Association of Trinidad and Tobago breakfast seminar, the then Health Minister, Fuad Khan, said a local study found 20 to 25% of the population had experienced a mental disorder or currently have a mental illness. This is 1 in every 4 persons. Mm-hmm. Today, how widespread is the issue of mental health in Trinidad and Tobago? Mental health problems I am talking about on the brink.
Well, it's very widespread. We don't know the exact number or frequency, because research is the important factor to give us the important details. But recent studies show that 80%, up to 80% of persons who need mental health care are not receiving the care they need.
There is no template. We are all cognizant of that. However, as best as you can, define what clinically is called a mental illness.
Well, a mental illness is, or mental disorder as we prefer to call it.
Mental disorder, thank you.
Is a disorder of the brain. Any disorder of the brain. And when you hear that definition, it's easy to believe that most of us would have some sort of potential for mental disorder. And that includes all factors that are associated with mental disorder. Well, mental disorder is the umbrella term. And under mental disorder, you have various classifications like schizophrenia, bipolar, depression, autism, epilepsy, personality disorder, and so on. But to go further, it's always important to spend time to understand or to explain to the public the nature and definition of mental disorder.
Yes, please.
If there is mental disorder, then in order to balance, there must be mental order. And the expectation is that we all were born with some sort of mental order. And that mental order is the fortunate circumstance where you are born with within the normal sphere of human birth, normal childhood development, go to school, enjoy relationship with people, get an education, marry, have a family, contribute to society, respect democracy and authority, and this sort of thing. That's the normal factor. Anything outside that would be considered, or the opposite of that will be considered, a mental disorder. And so that mental disorder creates various types of signs and symptoms, like confusion in the head, not understanding what is real from what is unreal, headaches, unable to sleep, hearing voices, seeing things, imaginary things, and perhaps situations where you may want to harm yourself or harm other persons.
In order to assist folks, of course, detection is paramount, and these are some of the symptoms that you're calling out that folks can look at before you start deciding whether someone needs to follow through on what may seem just off the beaten path or the straight path.
Yes. The mental disorder is cunning, baffling, and complex. And it's the area of medicine that is hardly understood. The typical person with mental disorder does not necessarily understand or realize that they're suffering from a mental health problem. So they would perhaps visit a physician because they're complaining of headache and can't sleep, and they would be on this medication for years and nothing happens. Until they suffered an acute relapse and they end up in hospital.
So-called snap or something drastic happens.
Yes. And so it becomes very difficult. In fact, research shows that it takes about 10 years to diagnose someone with mental disorder because of the confusion and, maybe I should try some medicine or some herbs, or I should visit a pastor, or probably someone did me something. All sorts of things play out. And the most traumatic situation is this thing called stigma. Because of
the societal taboo that's attached to it,
You draw yourself inwards, and people might be looking at you, and you might think, well, they're seeing that I'm mad, I don't want to look at people.
That mental illness is what we're talking about with my guest, Carl Ryan. He's a member of the National Association of Psychiatric Intensive Care Units in England, also a member of the European Violence in Psychiatry Research Group. He's affiliated to the Organization of National Alliance for the Mentally Ill, also that's in the United States. And that area is a strong area we must pay attention to. The societal taboo that's attached, it challenges folks with the illness. Education clearly is critical in eliminating the stigma and discrimination that is associated with it. It can lead to a refusal to get treatment, or for affected people to actually say, I have a problem. Are you comfortable with the number of clinicists and support services available to service these mental health statistics we have in Trinidad and Tobago?
Not at all comfortable. I'm very disappointed because mental health promotion is something that is close to my heart. Last week, a group of us celebrated 50 years in psychiatry. And having gone abroad and experienced the modern way of dealing and addressing mental health issues, we are far away from that. I mean, St. Anne's Hospital was built over 100 years ago to manage or treat and manage mental health persons. And no other modern facilities have been built.
Well, you used the term modern, and when you made the comparison as to how long it's been built, as a mental health consultant, have you visited there recently, and what is your take on what is being offered there for treatment?
I left St. Anne's Hospital in 1990 or 1989. And
because you were doing this before you left Trinidad, that is quite so, yes.
Yes. And I really thought that was psychiatric care, not having other measurement to go by. But when I visited England and traveled through Europe, I realized, well, look, what we were doing in Trinidad is just substandard. Traditionally, or in more modern terms, the treatment of mentally ill persons are motivated by health and safety, the Human Rights Act, and policies from UN Convention and so on, which indicates that mentally ill persons should be treated no different than to other persons, so that they should have, access to fresh air and exercise every day. There should be a garden attached to the ward so that they could sit out and just enjoy the fresh air. And unfortunately, nothing like this is
Is this the
experienced
training,
in
retraining,
sentence.
the lack of expertise, and or the failure to prioritize the whole restorative process system of dealing with mental illness?
Well, we need a rapid mental health reform. And we need to, when we talk about stigma, it's not just the person-to-person stigma or the community. Stigma starts from the top, from governmental
The planners
agencies.
and the legislators, yes.
Because if the planners don't take into consideration futuristic programs and research and policies and procedures, then it does not filter down to the ground level where it's needed most. And then we just keep on doing the same thing in haphazard manner.
My intent is not to single out any institution or to pass blame or anything like that, but to look at what we have.
Yeah.
What we have is St. Anne's.
Yes.
What you see there that is sadly lacking, that can be improved on and should be improved on with dispatch, with haste.
Well, we need leadership. We need a more modern vision of managing persons with mental health problems. We need a substantial care regime that look at modern or different types of medication. Sometimes patients might ask about, because some patients do research, and they would ask about certain types of medication, and their response might be, it's too expensive, or so on.
Which raises the one of the questions that I have to go into. The question, the accessibility. You already stated that we are woeful in that area. But how expensive is it if folks do not go to a St. Anne's, for instance? How expensive is it, from your experience here and as a consultant, for someone to seek mental health counsel, to seek help, to see a doctor?
Well, it's very expensive. I understand it's about $700 or $800 a visit. But the persons who need it most are in the lower income group or are unemployed. And hence the reason I really set up this NGO with perhaps the thought that I would partner with some agency to help to provide these services free to the public.
This is the NICER Foundation.
NICER Foundation.
And you are not in partnership with anybody right now?
No, I use my own pocket change to go into the community and support persons. Yesterday I've been to Mayaro to visit one of my clients, and I'm sure he's listening. And, when I look at the whole scenario of community psychiatry, it's not only looking after their mental health, but their social well-being. I purchase food stuff and food hampers and give to them, because most of the persons are single parents, women with young children, and hardly any source of supporting themselves.
Mental health consultant Carl Ryan is my guest this morning. We're talking about him setting up the NICE Foundation, which is an NGO to assist those who don't have access to the very expensive help in the area of mental illness. You have a website. Just mention that before we continue, so folks who may be desirous of getting in touch with you for assistance and or partnering with you, or at least finding out what they can do to work with you on this, can go to. Give me a website, please.
Well, first of all, my telephone number is 777-8576 or 301-4784. The website is www.nicerfoundation, that's NICER foundation.com.
Let me just repeat those numbers: 777-8576 and 301-4784. Or they can go and just Google NICER Foundation and find out about you, because this initiative is one that I'm sure there are many folks who are listening this morning would like to at least find out more about, if not get involved with it. Street dwelling is often dismissed as just vagrants. That's the street dwellers. They are referred to as vagrants. All the indication we have heard state that you're dealing at some serious mental disorders, addiction, as well as mental disorder. And I think, quite frankly, an addiction is an illness, so it is a mental disorder too.
Yes, there's a bit of confusion about which come first. When we look at one of the key symptoms of mental disorder, which is the inability to rationalize the consequences of your actions. Sometimes it's mild, moderate, or severe. And if you're unable to rationalize the consequences of your action, perhaps somewhere along the line that would lead you to make poor choices. And that poor choice could be drugs. The other factor is that persons might be silently, mentally disturbed. And the term we use is self-medication. So they use drugs in order to clear their heads, as they say. And after using those illicit substances for a long period of time, they then develop what we call drug-induced psychosis. And that makes the disorder more complicated, more difficult to treat.
Sets up some sort of parallel reality.
Yes. Yeah. And so that they find refuge in the streets where they could obtain money, foodstuff, and so on. And they feel comfortable, partly because of what the voices tell them. This is my home, you know. They don't see the need to bathe because they feel clean. They could be as, dirty as the street, but they feel comfortable. Anything, a bottle of cigarettes or a sweet drink cap has great value to them. So they will stuff these things in their pockets, and they would papers and all sorts of pieces of wire. All these things are valuable to them. That's part of the schizophrenic makeup. Now, these persons are very much despised in the community. They are beaten, kicked, all sorts of things. They're burnt with cigarettes. If you look at the average person in the street, they have some sort of scar from being attacked by members of the public. And so if we need to offer them some sort of care, and if we need to exercise this duty of care that is so important, we need to offer them something better than what they're experiencing in the street.
Yes.
I see the project in Port of Spain where they were taken and placed in...
this is down the Riverside area?
Yes, yes. And perhaps that was not as suitable as it should be, What's being offered should be a homely environment with compassionate carers, because these persons could be quite resistive even in receiving care that they really need.
Yes, because I had the line minister for the mentally ill, and Minister Coburn, and we were talking about this and the whole question of how long the city can or the government can in fact hold them, because you cannot hold them against their will. You take them to a place, and after a while they want to leave, they're going to leave. But what you're saying is you've got to find an inducement that they want to stay as against you wanting to keep them.
Yes, yeah. The other important thing is the Mental Health Act, which is the sort of reference guide. And the Mental Health Act is one of the strongest legislation in the world because it could treat you against your will. Because at the time you need the treatment, you cannot rationalize the benefit of the treatment.
That's right.
So if we have a well constituted Mental Health Act,
yes,
it would help to encourage the corporations or give sort of authority to the corporations to take meaningful actions. Our Mental Health Act is about 16 pages. And when I look at the Mental Health Act in the UK, it's almost 400 pages. And that is because it includes everything, including the police could enter your home and take you against your will into hospital for treatment.
For your well-being.
And the police are trained. The next point is that up to 90% of persons in prisons have some form of mental disorder. So it stands to reason that the people the police most likely to confront in the street might have some form of mental health problem.
I see.
So the police need to be trained in a certain way so as to treat these persons more humanely and effectively, so that they're taken into custody without due harm.
Carl Ryan is my guest this morning. He's a mental health consultant holding a Master of Philosophy in Mental Health. We're discussing his NGO, which is NICER Foundation. They've got a week of health coming up. I'm going to get that in a moment. I want to deal with a lot of what happens with people who are on the edge happens in the workplace. I get the feeling that many employers fail to see the impact a stressed out employee can cause them directly. Stress can be caused, of course, by or magnified by a number of workplace occurrences, whether it be job insecurity, improper job design, or schedules, unfair compensation, inadequate learning opportunities, lack of motivational sessions, and also ineffective mental health programs. My question to you this morning, Carl Ryan, is this: should there be in fact more educational sessions for employers to help in recognizing when an employee is showing extreme signs of stress? And is this asking too much of the employer?
Not at all, not at all. Perhaps I should start by saying that, and it was published a few years ago here in Trinidad, 77% of the workforce in Canada has some form of mental disorder. That is over 3/4 of the workforce. Of course, they would not just publish the statistics. They would be looking at preventative and management procedures and supportive procedures in the workplace. As the saying goes, it's better to save a good worker than to bring in a new one. And part of the employer's responsibility is to provide a safe and conducive environment for their staff.
Because outside of the home, the workplace is where a lot of people really get their stress from.
Yes.
I mean, and if you have an HR department that's paying attention, or even managers who are sensitive as to what they're looking for, you can see when an employee is stressed. And the most important reason for asking that is that the employers must understand that they benefit from a fit employee, a mentally fit employee. Now, I know you've got coming up the week celebration of Mental Health Day, which is October 10.
Yes.
Tell us about this Mental Health Week of activities you've got planned. It's in San Fernando?
Yes. Mental Health Day, World Mental Health Day, is the 10th of October each year. And I've realized that on that day, very little is done nationwide to emphasize or publish the, I suppose, importance of mental health and what mental health means. So I thought I would organize a week of mental health activities. And so it starts on Sunday the 2nd with a march around the city. We'll be having marching bands.
What is that called? A walk for mental health?
Walk for mental health. And so I encourage uniform groups and persons in the South area or any part of Trinidad who has the resources to come and join us in that march, because we need to stand up and show that look, mental health is real and we are in support of positive mental health promotion.
Thus far, what I understand is that you're doing this on your own.
My own.
Are you doing this one too on your own?
Yes. I've made appeals to various organizations with no help at all.
And individuals who are interested in joining you in this can contact 777-8576, 777-8576, and 301-4784. All right, so that's it. So let's go ahead with the schedule. You have the Sunday. It is the Walk for Mental Health, Harris Promenade. It starts at 8 o'clock.
Yes.
And you go through on Monday and so on. Tell us about the rest of the schedule.
On Monday, we got Let's Talk Mental Health with Men in Mind. On Tuesday, Let's Talk Mental Health with Women in Mind. On Wednesday, Mental Health and Youths. On Thursday, Mental Health and Relationships. And on Friday, Mental Health and the Family. These are specific factors where mental health issues tend to surface quite frequently. And on the Saturday, which is the final week event, we'll be hosting our 4th annual mental health seminar at the Susumacha Church Hall, 5 to 7 Carib Street, that's opposite Presentation College. And at that seminar, I tend to offer persons with mental health problems or who are seriously concerned about mental health problems to present. In this year, we'll be looking at having a group of persons actually suffering with mental health problems giving testimonies. So what I will do is interview them about their problems and how they're coping, how the mental health problem started, and then we will invite audience to ask questions, any question they may have. Now, this is quite a huge step because I don't think this has ever been attempted before.
You see, in looking at what you're attempting to do here, and that is what struck my attention, and I said, no, we've got to bring you to talk about this because, one, you were clearly qualified in this area. You've been working it way before you left Trinidad and Tobago. You've been back here for 6 years. And what I am not clear on, and maybe you can clarify for me, have you reached out to church organizations? Have they seen the need to join you? Have you met with government officials, for instance? I mean, have you met with other like organizations doing this and also that the corporations to assist in this? And what has been the response from all these sources, if you have reached out to them?
Well, you'll be pleased to know that I've been trying since 2005 with successive governmental agencies to no avail. I have contacted several NGOs to no avail.
Well, I'm not pleased to hear any of those, but go ahead.
And even corporate bodies.
What primarily you think is the reason they're not walking into this? Because it is not a priority. I find it difficult to accept that something so clearly a problem in the country, that's wherever you look, that they are not seeing in this. Is this, I mean, what are they seeing in this, why they are not participating?
It's very discouraging, but I have to go on because I feel this is my calling. But I think mental health promotion is not sexy enough. I'm just speaking broadly. And that some persons indicate to me that, well, yes, you're doing a good job, but I don't think I'm qualified to talk about this. Or I don't want to be associated with this because people will think I'm mad. This sort of thing.
One of the reasons that I believe could be attendant to this is folks understanding you are a very humble person for the qualifications you have. And sometimes folks walking around with this kind of attitude about them and that sort of thing. I laid out at the beginning your qualifications in this area. Just go through some of your experience quickly in the next 3 minutes so our listeners understand who is, I already laid it out, but tell them who is Carl Ryan, please. And I know your modesty will probably prevent you from doing it, but just put it aside for a moment.
Well, I started my psychiatric career at St. Anne's Hospital, spent 23 years there, and attained the post of senior nurse before migrating to the UK in 1990, where I believe I was indoctrinated into psychiatry because of all the experiences that I was exposed to. And I worked in lots of areas: acute psychiatry, rehabilitation, secure facilities, psychiatric intensive care, which we need in Trinidad, and that is for persons who are massively ill and uncontrollable, and they need to be stabilized. And so they would be placed in a special unit whereby they could be dealt with rapid tranquilization and care. I've worked in the prisons, and that was one of my great eye-opener for the amount of mentally ill persons that in prisons abroad. And I've worked in substance misuse rehabilitation, elderly care. Another important area was adolescents units. The adolescents unit is similar to what we call here the youth training center.
Yes.
But we only got one youth training center. But in England, they are strategically placed all over the country to address the rising costs in the young people with mental health problem. I must say that the greatest the major cause of mental disorder is inherited. 80 up to 85%.
And you want to deal with this from the adolescence area. I mean,
from school.
From there, you want to deal with it climbing.
Yes.
Now, you're a member of a number of professional organizations, as I mentioned before. This, too, is another reason that you're also a member of the Royal College of Psychiatrists Qualitative Research Group in the UK. The line minister here in Trinidad, you said you've dealt with successive governments. Have you tried with the new government thus far?
Yes, I have. Little success or no success at all.
Okay.
So, it's not encouraging.
Well, look, I am encouraged by what you're trying. I am looking at the mental health week of activities that takes place beginning on Sunday the 2nd and culminating on Saturday the 8th of October. Your telephone number, I have offered it out to folks, and I trust that people will get in touch with you to even become volunteers.
Yes.
Because volunteers are important to doing this. There are a lot of people that contact me regularly saying, I would like to do something, I don't know where to join, I don't know what to do. So let's throw out that telephone number again. It's 777-8576 and 301-4784. This is the NICER Foundation.
Yes.
I would invite you at another time for us to speak about the Conflict Resolution Institute, which is something completely apart. But as far as the mental health issue we're seeing, and from looking at your qualifications here and the time that you actually spend in the field, I am going to applaud you this morning and thank you very much, Carl Ryan, for coming in. I think it is a very good move that you're making here. It is an area that is very needed, and particularly needed because if folks try to get assistance in this area professionally, going to psychiatrists and so on, it is phenomenally expensive. You started at $800, and that is only a seeing first time.
Yes.
And then it gets a lot more complicated and a lot more expensive. My friend, thank you so much for taking the time to be with us this Sunday morning.
You're very welcome.
The NICER Foundation, you go to Google and you hit it, NICER Foundation. His name is Carl Ryan. He's a mental health consultant, 777-8576. I thank you so much for coming in this morning. Have yourself a wonderful day, sir.
Thank you.